come 3 ways to improve your blood sugar levels to help you improve your health and help you live longer. So 3 ways to control that blood sugar when we check in live with a doctor who is studying this. Stay tuned. Now, and high blood sugar and insulin resistance can cause all kinds of health problems. It can even lead to diabetes at any age. When it comes to women, the health risks can be even greater. And that is why live on the program right now, we have cardiologist and also researcher, Dr. Ernst von Schwarz. Thank you for being here. I love out of the gate what you were saying is 3 ways to control your blood sugar levels to improve your health. Let's start with step number 1.
Well, number 1 is, of course, exercise. We all know high blood sugar is a bad thing. And what we need to do with all the therapy and the treatments is we need to get the sugar levels down. And one way to do this is we need to burn the sugar, and this is by exercise. And there we have some clear recommendations nowadays. 5 days a week, 30 minutes of moderate intensity exercise. And that's for all of us.
And doctor, when you're talking about, we know that high blood sugar levels are bad, but are there some noticeable symptoms? If you haven't been in a doctor's office testing this, what are some things we should watch out for to see if we're in this category?
Well, unfortunately, there is oftentimes no early symptoms for diabetes or prediabetes, so you need to check it. Sometimes we feel increased thirst, so we need to drink more water. And in end stages, of course, we have severe symptoms such as dizziness if the blood pressures are sky high, or even life-threatening conditions like ketoacidosis. But in the early stages, it's asymptomatic.
Talk to me about how stem cell therapy is something that you're focused on to help us combat this. Is this a fairly new treatment?
Well, that's purely experimental. At this point, of course, what we have in our armamentarium is medical therapy, in particular insulin for type 1 diabetics, meaning juvenile diabetics, which is an autoimmune disease where basically our body destroys our insulin-producing cells. Then we have other medications, antidiabetics, in particular for type 2 diabetics. Besides that, of course, we have the option theoretically of an organ transplant, a pancreas transplant, which can be done in a certain selected number of patients, or islet cell transplants, which is an infusion into the liver. But besides those established surgical or interventional procedures, now we hear a lot about stem cell therapy, because in a petri dish nowadays, we can create B cells. These are the cells in the pancreas which produce insulin. We can create them in a petri dish and theoretically inject them into a patient. And there's other forms of stem cell therapy which have been shown in several studies with very promising results.
And here you are coming to us live out of Los Angeles. If someone watching here in Las Vegas thinks this is exactly what I need as far as treating where I'm at, do they tell their local doctor here to be able to get in on this since it's experimental? How does it work if they want to be a part of the stem cell therapy process?
Well, like I said, the stem cell therapy is at the current time not FDA approved. It's very promising. It's the future of medicine. We have no doubt about that. You have to ask your doctors, of course. Unfortunately, many doctors are not really don't have much knowledge about it because it's so new and so experimental. And the only way to get in is basically through larger academic centers where there's ongoing trials. But the other procedures, such as the islet cell transplantation, for example, this is an established procedure also in higher academic centers. And it's always worth to ask or get a second opinion from another endocrinologist or an interventionalist about those procedures.
Dr. Ernst von Schwarz, not only do we want to thank you for your time this morning, but thank you for what you're doing in this field of research, because this impacts so many Americans. We'll put all this information online at news3lv.com if this is of interest, where people want to do a little more research. Thank you, and we'll be back.